What do you think is the cost for calling an ambulance in India?
500 to 600, I guess.
It's actually 1,500 rupees per 10 kilometers. What do you think is the cost of calling a same ambulance in USA?
Now looking at the ultrasound price, maybe 25,000 INR.
$100?
$100 to $200.
Well, it is $1,200. It's actually 1 lakh rupees.
So, holy.
So, being a female, you must be knowing about C-section surgery, right?
Yeah.
So, what do you think is the cost for C-section surgery?
60 to 50,000.
I have no idea. 10 to 15,000.
70,000 to 1 lakh.
The average cost is, yes, 70,000 rupees. What do you think for the same C-section surgery in USA?
2 lakh, 3 lakh, $1,500, $2,000.
3.5 lakhs.
It's actually 18.8 lakh rupees.
Yeah. I am surprised to know it actually.
बाहर नहीं रहना मुझे नहीं रहना.
Hello everyone. You see, these figures are pretty huge and the difference is beyond comparison. And due to these skyrocketed rates, it becomes really hard for a middle class family to get treated. And you would be surprised to know that about 40% of the American population skipped or delayed their medical treatments because of expensive bills. And shockingly, nearly 66.5% of total bankruptcies in the USA are directly caused by medical bills. Insane. But on the contrary, India, which was once mocked by international delegates for having a low standard and cheap healthcare system, today hosts millions of tourists from all around the world to provide them with well-structured, cost-efficient healthcare. For example, a basic appendectomy costs around $7,000 to $14,000 in the US. The same surgery with the same procedures and no insurance bondage will cost you just $660 to $1,800 in a country like India. That means an average American can spend 21 times more on the same procedure than an Indian patient. And when I perform some basic mathematics, you will realize that if a patient from the USA books a business class airline ticket, comes to India, stays in a 5-star hotel, gets operated and then plan a week-long tour and then goes back to his or her country, they will still have some money left. Money enough to buy iPhone 15 Pro Max. And not 1 or 2, but 3 iPhone 15 Pro Max. Here we did all the calculation and you can have a look. Considering this fact, nearly 1.5 million patients from the USA visited India as per 2019. And not surprisingly, the Indian medical tourism is now at a boom, adding up to $6 billion in the economy, and is aimed at reaching a whopping $12 billion, doubling by the year 2026. Huge opportunities. But here's the catch. India is the 5th largest economy as per the time this video is uploaded. And the GDP of India is around $3.5 trillion. And India's healthcare budget for 2023 was 2.1% of its GDP. That is $73.5 billion. However, USA is spending $4.4 trillion just on their healthcare sector. And if they're spending such an amount in just one sector, that would simply mean that they would have provided cheaper facilities and those facilities be available and accessible to everyone. But in this case, in the case of USA, the things seem to be slightly off the track. So in this video, we will decode why the USA is so expensive, why even after change in governments, there aren't any frugal options, what are the loopholes that insurance companies are enjoying, and lastly, what are the possible solutions that can mitigate this. And before we move on, please make sure you subscribe to Decode with Abhinav to learn and decode exciting topics. See you in the next one. So, according to some field experts, the major reasons of increasing healthcare cost in the country like USA is divided into 3 categories, namely social, economic and systemic flaws. And along with this, I feel that this country possesses a loosely structured delivery system. By this, I mean that its healthcare system is organized at the local level, which makes it really worse for the consumers to treat themselves with a proper and legitimate procedure. You see, hospitals there are not bound to anyone and can open or close according to their preferences. And over 2/5 of the total physicians in the country are just engaged in solo practices, which leaves no scope for health planning at the federal level. And also, this video is not about bragging or promoting anybody. The Indian healthcare system too has some of the major flaws, like lack of adequate equipment, improper management, fake degrees, minimum clinical practice, and many more. But at least Indians don't get handed over with a bill of $100,000 after treatment. Yes, everyone, this might sound bogus, but in the USA, a patient who survived and battled the COVID-19 for nearly 62 days was handed a huge amount of $1.1 million after his treatment. And that's not it. Here's an example of a medical bill from a patient who was charged $42,000 for a basic surgery. But the main motive of telling you all this is to decode the medical bill. And if you notice that the bill amount is actually divided into 3 sharks of the ocean, that is, private hospitals, pharmaceutical industries, and the insurance companies. And these 3 players are the reason that American healthcare is so expensive. And for you to understand it in depth, I have simplified them into individual points. So, point number 1 is the opaque pricing in the pharmaceutical industry. According to the reports by Harvard Business School conducted in 2007, nearly 40% of the worldwide drugs in the clinical development originated in the US itself. But currently, the US is rapidly losing its grip, as in the recent study published by JAMA Reports states that in the US, the rate of research funding and the research for new treatments has declined a lot. Now the question would be, if everything is declining, then how are these companies making huge profits? The answer is the poor drug regulations by the FDA. Well, I'm saying poor, but in reality, it is nil. FDA doesn't regulate the drug prices in the country.
The FDA has no authority over drug prices. Valiant Pharmaceuticals raised prices for 212 and 525%.
Which means the manufacturer, distributors, and retailers are free to control the prices and raise them as much as they want to be. Yes, as much as they want. And if a company got their hands on brand new medicine and got it patented, then they have the full right to charge as much as they want. Doesn't matter if the patients live or die. And you might have heard about this guy, Martin Shkreli. Though the patients were badly suffering, but this guy did not decrease the price.
You know, Martin, when you bought the company, this was a $1 pill before Core Labs bought it. Then it went to $13.50. Now you bought it. Now it goes to over $700.
There's no doubt I'm a capitalist. I'm trying to create a big drug company, a successful drug company, a profitable drug company.
You see how greedy this move looks.
However, in India, there is an organization named as National Pharmaceutical Pricing Authority or NPPA, which has set the rates according for each and every drug or its segment, thus maintaining a transparency in the B2C market segment. Hence, this could also be the first possible solution for the USA too. Which brings us to the next point of the video, the insurance companies and administration expenses. You see, hospital bills are usually huge, and that is why these insurance companies come into play. Health insurance offers a way to reduce such costs to more reasonable amounts, and they do this typically by collecting upfront premiums from their customers each month. And this in turn allows you to share the risk with lots of other people who are making similar payments. But in the USA, things are different, and insurance companies have found some loopholes. And out of those loopholes, I want you to understand this one with an example. So, let's say you bought a healthcare insurance policy in the USA, which covers a specific drug with a specific quantity under it. For example, levothyroxine 250 mg, which is primary use for treatment of thyroid. Now, if the doctor feels that you need some extra dosage and prescribes you with a levothyroxine 300 mg, well, this will end up in you making the entire payment by yourself, and the insurance company will not be liable for it if the dosage is exceeding the values mentioned in the policy. If this medicine and its dosage is not included in your insurance policy, you will end up paying the amount from your pocket until the treatment is over. And if it is forever, it's gonna remain forever. So, the possible solution for this could be the regulation by the government to include a comprehensive list of essential medications with the right dosages, which ensures that the critical treatments are accessible to all policyholders. Point number 3. Point number 3 is defensive medicine and test malpractice in private hospitals. Well, the USA got a good legal system, and I really admire that. And the penalty amount for mistakes or wrongdoing for technical companies is very high. They're afraid of it. I mean, a slight mistakes and the penalty amount is just enormous. And this is also leading to a very expensive treatment, because now the doctors are afraid of getting sued even for the slightest mistake. Hence, they suggest the test even if they might not be needed, which eventually increases the bills and put patients' pocket at risk. So there could be multiple solutions to address this. However, exploring alternative judicial methods to resolve these disputes can help reduce the prevalence of this. Although the American medical system has contributed to remarkable advancements in the medical science of the world, and I completely admire that. But there's this one aspect that really needs attention, and there is also a very famous quote by Joe Biden, which I personally liked. But mind you guys, it was before he became the president. I quote, "We can no longer afford to ignore the inequities in our healthcare system. Access to quality care is a right, not a privilege." And if you see just the quote, it really makes sense. But there is one thing that doesn't make sense, and that is the same design of Apple's iPhone. And even after thousands of customers complaining about their same design over and over, why is that Apple seem to ignore them, and how this strategy is making them billions and billions of dollars? Let's decode Apple's secret strategy to conquer the market by clicking on the video here.